Guys, good evening. We are live. Welcome to Cosi Talks. So guys, I'm going to give you a couple minutes to jump on board. With me, I have Ronnie Dickson from Prosthetic, Orthotic Associates of Tennessee. Second
Howdy,
time.
everybody.
All right, guys. So I'm going to give you a couple minutes to jump on board. In the meantime, for those of you who are watching the replay, I always like to go back and watch and see who is watching the replay. So if you have any questions, tonight is the night to ask your questions. We have an amazing prosthetist here, there. And
somewhere over here anyways.
Somewhere over there. We're going to be talking about liners tonight. So as I said in the post above, the liners are the unsung hero of the prosthetic componentry, and they don't get a lot of attention. So I'm glad that tonight is dedicated just for the liners. We got Kim Richards on board. Welcome aboard, Kim. Guys, for those of you who are watching me live, don't be shy. Let me know who you are, where you're from, and what's in your coffee mug. Did you bother to get anything in your coffee mug, Ronnie, or we were too busy troubleshooting?
Oh yeah, too busy troubleshooting. As you can see, I've got my headphones on because the speaker on my phone doesn't work, so I have to wear these headphones. And on top of it, I forgot to bring my computer home from work with me, so we're having an awesome time here.
Awesome. But you know what? We've got some amazing pictures, which I love. I don't often get to share a lot of great pictures. So this is, we got a lot of people coming on board. We got Tom on board. Tom was our big winner of the Lululemon giveaway last week. Go Tom. We got Harsh on board, Chuck from Wyoming with his iced tea. We got David from Maryland. All right. We got Barbara on board. Hey, Barbara, there's Bonnie, Denise Jackson. Not even a mug, a water bottle. Okay.
We got a lot of people here already.
We do. We got a nice crowd. There's Pastor David. It's a party. Sup, Eric? How you doing?
My buddy Eric there.
And there's Andrea. There's our token occupational therapist. All right. May the 4th be with you. I was waiting for somebody to come out with that. I forgot my Star Wars shirt. I only get to wear.
Oh my gosh, I know. I forgot mine too. I've got the Baby Yoda costume at the office. So
you have a Baby Yoda costume? Well, you'll just have to come back on the show and we'll have to redo it. Okay, Teresa, how are you? All right, Eric's got his Pepsi. Guys, we've got a great crew on board, so we're just going to go ahead and jump in and get started. For those of you watching for the first time, welcome. My name is Cosi Belloso. I'm a physical therapist amputee specialist here in hot, humid, sticky Florida because it's already summer here. And with me tonight, I've got Ronnie Dickson, amazing prosthetist and owner of Prosthetic and Orthotic Associates of Tennessee. So say hi, Ronnie.
Hey, everybody.
All right. Brett Cool Kid is here in the house. Hey, Cheryl Lee. So, Ronnie, you are no stranger to the Cosi Talks studio, but for the folks here watching for the first time, tell us a little bit about yourself.
Oh, boy. I am an above-the-knee amputee of 15 or 16 years now, one of those two. I've been working in prosthetics for about 12 of those years. And I guess in relation to today's conversation, I have quite a bit of experience working with liners, whereas maybe some other professionals had to use other materials in their career. Since I started my career back in 2010, we have been able to use basically exclusively, and which is great because I think they really do a lot to help protect the residual limb and keep everything cushy and comfy. And been able to do a lot of really cool things with liners because the practice that I started working at, Prosthetic and Orthotic Associates in Orlando, Florida, was one of the first pioneers of building a practice around the idea of custom liners. So we'll talk a little bit about that at the end of the talk today, but it's been exciting. It's been a great time to be in prosthetics, and it's been a lot of fun.
Awesome. And guys, Prosthetic Orthotic Associates is the official name, but many of you might have heard POA, and that's kind of a how you might hear about their clinic as well. And they do have one in Orlando, and Ronnie is in Chattanooga, Bonnie. So Bonnie's in Knoxville. He is in Chattanooga, Tennessee, which apparently made the top 10 cities to be in now in the U.S.
You got to stop telling people. It's a great town to be in. We really have a lot of fun here.
Apparently Tampa also made #1 for housing. So I'm just like, shh.
Yeah.
Stop talking. Right? All right. We got Leanne on board from California. We got Patricia looking forward to the information. Hey, Sandra, thank you for joining us. So guys, like I mentioned, today we're going to be talking about liners. I get so many questions about liners. And the other half of it is many people aren't aware of just how much of an impact their liner can make on their fit. So you guys have heard me talk a lot about how if your socket is comfortable, you can walk in pretty much anything. And then the opposite is true. If your socket is not comfortable, it doesn't matter if you have the Terminator leg sitting underneath you, you are not going to be going anywhere. And part of what contributes to the comfort in your socket is not only the skill of the prosthetist and how they shape and mold the socket, but also the kind of liner that goes into it and how you don it, doff it. And we're going to give you all of that information tonight. So let's just start off with the basic definition, right? Liner is that protective cover, and it's made with a flexible cushioning material. And its purpose is to basically decrease the movement and friction and chafing within the socket, right? The more that we can stabilize that limb within the socket and prevent movement in that socket, the better the fit, the better for your skin, that you won't have any, hopefully, skin breakdown. And guys, I'm going to show you just a little throwback here. So quick story, when I first started working in prosthetic industry 20 years ago when dinosaurs roamed the earth, we didn't have the really cool liners that we had today. We had, let's see if I can do this. I practiced. Oh, come on. Really? No. No. There it is. All right. So if you guys are looking here, right, you see this liner here and this liner here. This little tiny guy in the middle, that's what used to be the liners that we use, and they're called the POA liners, right? And basically, those of you who are veterans, amputees, you're nodding your head going, yep, I recognize that, right? You used to have to put your socks directly onto your skin and then put your limb into here, and then this went into your socket, right? We've come a long way. We've come a really, really long way.
Oh, yeah.
Oh,
I mean, not to mention, with the P-Light, you had very limited forms of suspension. There wasn't a pin to click in with. You couldn't have suction. It was really kind of hard to achieve much of anything with it. You would either have down really hard above the knee to get what they call a supracondylar design, or, with an above the knee interface, you would have to wear a belt. So there really weren't choices for how to keep the prosthesis on, and that certainly wasn't much fun for a lot of people.
Yeah, and then not to mention, yes, those were technically custom made and molded to the individual, but that foam, once that shape and size was in there, that's it. So the people with the changing of their limb volume and shape, it was just no bueno, no bueno.
Oh yeah, and not to mention too, they're all custom made, and there isn't a mold for it. So if you wanted to replace the P-Light, let's say you had a fit you liked and you wanted to replace it, it was pretty difficult to replicate, which is bad for sure.
Yeah. So, Ronnie, just a warning, Zach Gowan is listening in tonight.
Oh boy. We got everybody in the audience today.
We got everybody in the house. So we got to watch. Zach, I'm watching you.
I'm glad he's not on the air. He'd be heckling me already.
He's got. Oh, give him a second. Just give him a second. He'll start.
Oh no.
Eric says I have a neon green one that glows in the dark. I don't think I've ever seen a glow in the dark liner.
Yeah. We've made Eric a blue liner, a purple liner, and a neon green one too. So we've tried out a bunch of really cool stuff with him.
That's kind of awesome. So guys, nowadays, thankfully technology has come a long ways, and we have 3 basic liners. Okay. So much like when I do my talk on prosthetic feet, there's so many options out there with liners that sometimes it's a little confusing as to, well, this company makes this one and this company makes that one. And how do I know the difference? And how do I know which one to choose? So I like to just think of the liners in their basic classifications, meaning the materials they're made out of. And you've got 3 basic ones. You have the silicone liner. You have the gel liner, also known as thermoplastic elastomer or TPE liner. You'll hear those names being used. And then you're
say that 3 times fast.
I know, right? I'm like, I'll say it once on the show, and then after that, it's the gel liner. And then we have our polyurethane, sometimes called urethane. Sometimes people refer to them as the custom-made liners, and even though that's kind of a misnomer. So let's just kind of go through these. The silicone. Let's start with the silicone liner. Which brand is it? I want a glow-in-the-dark one. Bobby wants a glow-in-the-dark one. Okay.
Those are custom-made right there.
You'll have to go visit Ronnie over in Chattanooga to get yourself a custom-made glow-in-the-dark liner. So guys, probably the most common one that I see among my patients and I hear from my viewers is the silicone liner. It's a nice basic go-to liner. It provides really good stability, really good adhesion and total contact to the skin, which is really important for a liner. And especially if you have a lot of redundant soft tissue, okay? And it can be used with all the different type of suspension systems. It's usually made for a little bit more on the active side. So people who are a little bit more active, it's just a little bit thinner sometimes than the gel liners and the polyurethane liners. So Ronnie, what are your thoughts on silicone?
For sure. I love silicone as a material. The vast majority of people, I'm talking about 99%, are not allergic to silicone. So in terms of creating an allergy, it's really, really good on the skin. It's very hygienic. I think the main thing to point out with all of these liners that we're going to go through is they're all some form of a gel-like material. And the difference in the surfaces is very, very big. So we talked about there's two different kinds of material. There's an open cell material, which the pores of that material are actually open, the membrane of it, and closed cell materials like silicone, where if you wipe that surface clean, there's nothing that's actually going to embed itself in the material. And I think that's a really big distinction to make as we go along. So talking about the silicone first, it's a closed cell material. So that's one of the reasons why it's really, really good for this application, where it's going to be a moist, humid environment. We talk about it's against our skin, right? So it's a really, really easy material to clean because once you wipe that surface down, there's nothing that's actually gotten embedded in the pores of the liner with the silicone. And then they've done studies on the rebound characteristics of silicone. And generally speaking, when you push down on it, it will rebound back to its original state. So it can really take a lot of impact, which we know, if you're walking 10,000 or more steps a day on that liner, you're really putting it through its paces. So silicone is a great material for hygiene and for durability.
Yes, and as Bobby just put so eloquently, silicone doesn't hold the stinky as much. That's exactly
He's 100% right.
He's absolutely right. And it was interesting because I've noticed that in seeing patients, and I would notice certain liners, I'm like, man, and I know this is a clean patient. I know this patient cleans their liner and they keep themselves clean, but it just grabs on. And when you mentioned about the open and closed cell, I'm like, well, that explains it right there. So when we compare it to the polyurethane, you guys are going to see some of the pros and cons. And again, guys, as with everything we talk about on this show, there's pros and cons to each of the products that we talk about. And you have to really just make a decision on which are the pros and cons that best apply to your lifestyle, and then go out and do the comparisons among the different companies that offer these to see what is the best one for you. All right, so that's a little bit about the silicone. And I remember just back working in the burn trauma days, we used a lot of silicone sheets to help with burn scars because of the fact that it was very low allergenic, hypoallergenic is the word I'm looking for right now. Bonnie says, I'm in lanyard liners as a bilateral AK, and I'm getting ready to go into suction socket to get me ready for microprocessors. So guys, and this is something I always like to make a distinction. Your suspension system is what holds the leg on, right? And a lot of times the suspension system is sometimes connected to the liner. So those of you, for example, who have pin lock, right? You have that little pin sticking out of the bottom of the liner, okay? But it's a separate thing that we're talking about. The liner is what goes on the residual limb. The suspension system is what keeps the actual socket on, right?
And so I think we've got a talk coming up later this year on suspension systems, right?
Yeah. Yes, very good. In August. You did your homework, Ronnie. Nice.
Yeah.
Right. All right.
Read the paper somewhere.
So when you signed on the dotted line.
Yeah.
All right. So we talked about silicone liners, guys. The next big classification is the gel liner. And I'll try to say this one more time. Thermoplastic elastomer, TPE liners, right? I call this the Cadillac, right? It's kind of like the soft, cushy ride. And this is definitely a little bit more moldable to the limb shape itself over the course of time. And it's usually good for folks who have lower activity levels. A lot of times they come built in with nice skin-friendly mineral oils or vitamin E. And again, works well with suction system, suspension, and pin lock as well. So what are your thoughts on the gel liners?
Yeah, the TPE is great. I mean, especially when people have really, sensitive or fragile skin. I mean, it's a really just comfortable material. each manufacturer does their own different version of the gel, but it's soft, it's plush. It's like when you get into like a really well-worn recliner and you're just like, oh man, I could just sit here all day long.
Right?
So, but that does have some, when it comes to activity and things like that, then there's a pro and a con to everything, unfortunately. So, with the TPE liners specifically, that material doesn't have great rebound characteristics. So it's real cushy to sit into, but then after it gets a lot of impact over time, patients might notice that it wears over the bony prominences like the bottom tibia or the fibular head, and it actually will flow away from those areas. So now what used to be maybe 6 millimeter thick has now become 3 millimeters thick, or even has worn away completely because the material doesn't really have great flow characteristics for a liner.
There you go.
So that's the negative. You're maybe going to have to replace them more frequently. I've got a really, really active BK in one because she prefers a pin leg. That umbrella on this particular one fits the bottom of her leg really well. And we'll talk about the umbrellas here in a little bit that go on these pin liners. But she blows through these things in 3 to 4 months, and it just is what it is. We just stocked up and going because for her particular case, that's the best choice I can give her. And, we made that decision together. She knows, and we kind of talked about all that up front. But, and then to know about TPE too as well, you might notice that the liner starts to get a little bit of a yellowing after time. And that is due to it being a open cell material. So it's going to be a little bit harder to clean over time. And it will get up there on the stink factor as I think it was
Bobby.
Yeah, Bobby had mentioned. Yeah, the stink meter on that isn't all-time high, but it definitely can be for sure.
Okay, and he's actually suggesting we put a stink meter, which I'm going to kind of draw the line there, Bobby. No, I'm kidding. All right, so Bobby does ask, if you're the patient, how do you know what material you're using or have? I know how to look this up, but some may not and may be curious. So usually I look up the brand name, Bobby. If my patient doesn't know, I'll call their prosthetist first of all and just ask, okay, what kind of a liner did you issue them? I'll look up the brand name and just kind of look it up and try to match it up. I feel like in comparison to the silicone liners, the gel, they're just cushier. Like you can just really jam your thumb into it and it's just like a really squishy. And then the polyurethane ones, they're custom and they have like kind of almost distinct, almost like a yellowish on the inside. But again, usually I end up having to look it up or ask the prosthetist what they're using. But I think it is important to find out. And we're also going to talk about how to know what to choose and what questions to ask your prosthetist about this. Yes, Thomas, we're now getting to the custom urethane liners that are the Lamborghini of liners. I like that. We got the Cadillac and now we're going to head to the Lamborghini. So these are the polyurethane custom. They are custom made. They are a bit more expensive because they're custom made. And because of that, usually, with my patients, they have to be fit molded, they're sent out, and it takes a little bit longer to get them back, the turnaround on that. So those are some of kind of the cons of the polyurethane. For me, I typically, when my patients come in and they start asking me, do I need a new liner? Do I need a new liner? For me, the perfect candidate for one of these liners is somebody, for example, who has a below the knee, very prominent tibia, someone who has a lot of problems with breakdown because maybe they have some skin grafting. I'm actually thinking of one person right now that I'm going to recommend that he get one because these polyurethane, they're meant to really shuttle away the pressure on those hot spots. Ronnie, what are your thoughts?
Yeah, the polyurethane is a really, really interesting material. It's got great flow properties. And I like to tell people in an analogy that anybody could understand. It's like the waterbed of prosthetic liners. You just get into it and it just, has this real nice, easy flow to it. I think what Thomas said there about a Lamborghini of liners, I mean, I definitely don't think that's a bad way to describe it either. You know, you could almost say that custom urethane liners are the Lamborghini, and then like custom silicone are the Ferrari, and it's just a matter of like what your preference is. It is worth noting that these liners really only come from one manufacturer. So there's one manufacturer specifically that has the conglomerate on urethane, on polyurethane. Yeah, I guess it's worth noting, you know, because people are going to want to use our talk as information. Ottobock has the conglomerate on urethane. You won't see urethane sold from any other prosthetic manufacturer for in the liner form. Specifically, yes, in the liner is where that kicks in. Yeah, you know, I'd say the cons to that is they're definitely more expensive than other liners. So if somebody's looking at an out-of-pocket situation, I mean, that's possibly the most expensive situation you can put yourself in is a custom urethane from Ottobock. Then, you know, these are open cell, and it's a little bit different than the TPE. The TPE wears away, but because the urethane doesn't really wear, it just absorbs. So in my experience, when I've seen these urethane liners come back, people are able to wear these for long enough that they will turn black. I've seen these liners come in black because they are durable, but because they're open cell, they constantly absorb everything. And you could boil them, you could clean them with alcohol, and it's just a very porous material. You could take one brand new out of the box, make a Sharpie mark on it, and it's already permanent. You can't take it out. So whereas another liner, you could just spray some alcohol in there and clean its surface and that would come off. So I'd say that's the one big drawback to urethane, or a couple of them. But the people who love them swear by them, and they definitely protect the residual limb in a really nice way.
Yep. And guys, it's one of those things where I'm kind of old meat and potatoes kind of practice, in the sense that when folks, whether it's viewers or patients, come and ask me about what componentry should I get, usually I like to say, especially if it's your first leg, to start with the more simpler setup. Basically because you just want to see what's working for you and what's not. So when it comes to the liners, unless there's something glaringly obvious, you know, and if it's somebody who's a high activity patient, I usually will say, you know, let's start with a silicone liner and let's see how that works out. And then if the person's having difficulty or having breakdown, or there's some sort of limitation, then it's a time to say, okay, well, then let's look at a bit of a more expensive option. I don't typically, and that's just me, every clinician is a little bit different. I don't typically jump in and say, let's go for the most expensive liner out there, you know, out of consideration to the cost for the patient as well, if that's not necessarily what they need. I don't know what your thoughts are on that, Ronnie.
Oh man, yeah. So liner prescription, meaning what I might recommend or choose for a patient, is there's a lot of nuance that goes into it. And as someone who custom makes his own silicone liners in his practice and has the ability, or has practiced with custom liners for his whole career, it's not always the best choice for everybody. You know, but what constitutes the best choice, you know, the right choice for any given individual is really on a case-by-case basis. So I like working with custom silicone liners a lot. It's what I know how to use really well. You know, but just to use an example that I was actually planning on using later, I know a gentleman up in Chicago whose practice basically revolves around pin and off-the-shelf liners. And the things that he does with those liners, I couldn't do because he's more experienced at working with some of those products than I am. So our skill sets are different. So I'm very good at working in my realm. He's very good at working with his. And you know, I'm fairly certain that if a patient came to see me and a patient came to see him, they would both have an excellent outcome. So I hope that answers the question.
Yeah, no, it's one of those where I think everybody works a little bit differently. Like I said, some people, and I talk to all the prosthetists in my area, and they have a slightly different approach as to how, when they do the liner prescription. And as long as the patient outcome is good, thumbs up.
Yeah. And it's worth noting that these liners, they all have different costs, but what the insurance reimburses is off 1 or 2 L codes. There's an L code there's actually 4 L codes. There's off-the-shelf pin, off-the-shelf cushion. So it's just the difference between the liner having a pin or not having a pin. And then the custom liner has its own code. So I guess what I'm getting at is like, there's like in anything, you could go to the car dealership and there's really cheap cars there and there's really expensive cars there. With the way the prosthetics works is it gets reimbursed at one rate. So, there's definitely liners that are made poorly by certain, or liners that are meant to be cheap. And that's across the board with all manufacturers. And then there's liners that are higher quality. So, I think that, at least most of the prosthetists that I've interacted with, and the ones that have a lot of respect for the way that they practice, meaning they put a lot of thought and energy into how they fit their patients. Generally you're ending up in I'm seeing that the higher quality products are getting used, despite whatever the reimbursement is. Yeah, but there definitely are some products that you just see and people might chew them up in 15 days, a month if they're really active. And, while I'm not saying that it's not possible to do that with a higher quality product, but the higher quality products are high quality for a reason. And that's not specific to a manufacturer. That's just, every manufacturer has lots of different versions of liners that they provide.
All right, we got a question here. Bobby says, what are your thoughts on liners and gentle cycle in the wash? I'm going to go, I don't know about Ronnie. I'm going to let him answer, but I'm going to go with a no. Please don't do that.
I'm a hard no on that.
Please don't do that. We're going to get to the liner care and hygiene in just a minute, but I wanted to not forget that question.
Yeah, I'm a no on that. I'm a hard no.
No.
It would be entertaining to watch, I guess.
Just imagine. Jeez. Okay, anyways. All right, let me go ahead because I realized we need to do a giveaway. We got to do a giveaway.
Oh, yeah.
All right, so guys, we're going to do the Prosthetic and Orthotics t-shirt, which is a really cool looking t-shirt, guys. We're going to do that giveaway now. I am posting right now the Facebook page for POA Tennessee. All right, I want you to right click, don't click out of the show. Right click, go to that Facebook page, okay? I want you to scroll down and a couple of posts down, you're going to see a tournament that POA recently sponsored. I want you to tell me what kind of a tournament they recently sponsored and put that into the comment section. We're going to pick a winner from the raffle there. So I'm going to give you guys a couple of minutes to do that. So go to the Facebook page on POA Tennessee, scroll down, couple of posts, you're going to see a tournament. What kind of a tournament did they host? Go. All right.
What kind of tournament did we host? I'm curious now.
You don't remember? Oh my God. Are you serious?
I'm joking around.
I was like, y'all did a really good tournament. All right. Well, Eric, if you know, put it in there. Come on now. And guys, I just want to remind you, Eric is watching from the YouTube channel. I am broadcasting to Cosi Talks on my YouTube channel as well. So I know there's some folks out there who are not huge fans of watching on Facebook, and that's fine. You can go find me on the YouTube channel as well. Benny, you putting a baseball up there? Seriously, Benny? Come on now. Bobby says, I washed my willow wood liners in the wash, but the Iceros, no bueno. Yeah. Yeah, and I think you got lucky on the willow wood one too, Bobby. I'm just going to go on a limb and say that. All right, guys. So let's go ahead and move on just a little bit. Ronnie brought some awesome pictures. So yes. I love pictures because pictures worth 1,000 words. Guys, keep putting those in the comments section. Keep putting your answers in there. All right, Ronnie, I'm going to do the share screen.
Yep.
And I'm going to let you navigate.
Sure thing. Let's go ahead and start with the... let's just go with the off-the-shelf cushion, the one of the residual limb, not wearing the liner.
Off the shelf. Here we go. All right, there we go.
All right. Yeah, so this, let's see. Are you able to make that bigger? Okay.
That is all yep.
Okay, yeah, so we've got the off-the-shelf liner right there. And, we're going to kind of freehand some of this stuff, but this residual limb is very, very cylindrical. So there's not like a whole lot of different shape and curvature going on along with it. The one thing that I love to tell people who are in suction systems is a lot of times I'll see those liners trimmed really short. And so by the time that you raise that sleeve up against your skin, you're not able to create a really, really good feel. It's arguably you're maybe not even holding suction at all. It's just a sleeve suspension at that point. So you'll see in this picture here that the liner is actually folded over at the top, so the silicone is exposed. So when you roll that sleeve up and that sleeve sticks to the silicone, it's going to create a very, very good seal, and this person will have a much easier time holding suction. So this is across the board for any liner. When I do this, I prefer to have liners that are thinner in profile up at the top, so that like just a 6 millimeter turnover or something like that. Anyways, that's something that I wanted to share. And then Cosi might be able to click on the picture next of the residual limb that was under that liner.
Okay.
Which should be right next to it. It's right there. Yep. And that's coming up. So you can see it's very cylindrical in shape. So an off-the-shelf liner for this person was a really, really excellent choice.
There you go.
And then kind of coming up next, let's do the pointy limb is what I have it named.
Pointy limb. Okay, please hold. There we go. So the pointy limb without the liner, obviously.
Yep. Yeah, so right there, I mean, we've got a different kind of residual limb. And in this case, there's a couple of different things you can do. One is, a custom liner might fit the profile of that leg better, because most of the BK liners that get made are not a V shape, they're a U shape or a cylindrical shape. And then if you'll, right next to that photo is pointy limb with distal cup. So this is an example. Oser makes a product called a distal cup. So when you put that piece of gel on, which is a lot thinner in profile, you would actually put a silicone liner over top of that. So in a leg that was pointy, and we've rounded out the bottom and created more cushion. So now we're going to have a more even surface to grab onto there. So that's a tactic that we can use in that case when you're not doing a custom, you still want to do an off-the-shelf liner. The next one that I'd love to do is I've got one here that's named Bad Umbrella, and then Bad Umbrella Limb.
Oh, I remember that one. Yeah. Bad Umbrella.
Okay, so this liner is beat up. We're not talking about the fact that it's beat up. Down at the bottom, you'll see it has a pin. And the umbrella on this is actually a wider umbrella. It's probably 2 or 3 inches wide. But now when she pulls up the picture of the patient's limb, which is Bad Umbrella Limb, you can see that leg is really pointy. This is actually a different one. This is a completely different person.
Okay.
But because that leg is super pointy, Ella is really wide at the bottom. His leg never actually sits in that liner properly. So this was someone that came to us and just a couple of pictures that I had on my phone that we could use for show and tell. I would try to find a pin liner that had a smaller umbrella so that it could sit more intimately on the leg, or just use something completely different altogether. Would be the way that I would go with that. So those are kind of just a couple of examples of some things that we had come up there. And then the last thing before we move on, Cosi, and we can do some of these later, is I want to talk about the redundant tissue. So if we can go to the redundant tissue, no hold.
There, yep.
All right, so in this picture, this is a very, very common below the knee presentation. Redundant tissue is basically just a fancy way of saying extra skin or extra flab down at the bottom of the leg. And naturally, as everything atrophies and loosens up, this is a very, very common presentation. So because the leg is hanging in this position, it exposes the tibia when the tissue hangs down, because now this tissue that was flapped underneath to protect it has become loose and it hangs down. So oftentimes, if you cast the leg, you have to be really, really careful of your treatment of how you put the liner on this leg and how you cast it. You want to actually pull that tissue up and put the liner on. You don't want to put the liner just straight on the end of that and then keep that tissue pulled back. That's bad. That's not going to feel good. So now if we go to the redundant tissue held up, I'm just using my hand there at the very, very end of the residual limb, holding that tissue up. And what do we see with that jagged and pointy tibia? It's completely covered up, as it should be. So it's really important when you don your liner to pull the tissue up and pull your liner to kind of hold it in this orientation. And it's really important for the prosthetist when he casts, because the liner is going to hold it up better, but it's not going to hold it up all the way. And most of us get casted in the position. It's really, really important to hold that tissue up. Maybe pressure in the back bottom like that would feel not good for somebody who doesn't present like this. But with all the amputees that we work with, by holding the limb in this orientation, we get really, really good outcomes with people that had poor fittings previously just by holding the tissue up. We protect the tibia and kind of keep everything in its proper place.
There we go. All right, those are some really great pictures. Hang on. Let me just see some comments were flying in here. All right.
Yep.
All
so
right. Just to announce the winner of our giveaway, Kim Richards. Congratulations, you are the winner. And yes, POA hosted a fishing tournament, which it looks like a lot of fun. All right. So Kim, when the show is over, make sure you private message me your t-shirt size and your address so we can get your shirt out to you. All right, here we go. Let's keep going. Johnny says, I had experienced a skin issue with some liner in the beginning. There was also issues that resulted from skin shearing. I was grateful when I found a liner that was tried and true to my skin and ways to control skin shearing from occurring. Let's see. Do any liners come thicker than 6 millimeters?
I think they do. One of the users noted that they had a 9 millimeter liner. 6 mil is generally considered a very thick liner. And that's generally referring to the profile through the body of the liner. So is normally, somewhere in between 9 and 12 millimeters, just depending on what its intended use is for. And then what the 6 mil means is that it's going to transition to 6 mil thick the whole way through. Even if a liner is 3 millimeters thick, it's often a lot cushier at the bottom because that's where you need the protection, whether you're above the knee or below the knee. Some prosthetists, and I guess this is where I have the luxury of throwing in a personal opinion. It's not right or wrong. It's just my opinion. Might say, oh, when you shrink out of a socket in a 3 millimeter liner, let's just put you in a thicker liner. And just for the record, I'm vehemently against that, because you don't shrink evenly. You might shrink specifically in just some spots, or your shape changes, which does make you eligible for a replacement socket, which is a whole nother can of worms, but I'll finish the rant. And putting on a thicker liner isn't just magically going to solve everything. So I guess that's my 2 cents on that. So if you want to start using a 6 millimeter liner because you like it, that's cool. That's totally okay. But to start in a 3 millimeter liner and then transition to a 6 millimeter liner because you lost volume, it just seems like a Band-Aid fix for what the actual problem is.
Now, here's a question for you, Ronnie, and this is something you can maybe personally comment on, is do you notice the difference in your proprioception when you're in a thinner liner versus a dramatically thicker liner?
Yeah, you're definitely going to get less feel. And, it kind of just depends. Obviously there's a mixed, fumbling my words here a little bit, but, there's protection and then there's feel and there's a happy medium somewhere in between there. But we get lots of patients just say, oh, if I needed thicker, let's pretend we had 12 millimeters down at the bottom, and that's plenty of protection for the distal tibia. And somebody might say, oh, well, we just need to make it thicker. Like, no, we actually just need better design of this socket so that it doesn't hurt you there. But making the liner thicker isn't going to solve this problem. So I think it's just kind of remembering what problem are we fixing here, and are we treating the right symptom? So, yeah, thick is good up to a certain point, and then making it any thicker has 0 point at all. You could make it 32 millimeters thick, and you're still going to have pain there if it's not designed properly.
Yeah. And it's the same thing with people who keep adding socks. When at some point you can't add any more socks, you have to change the design of the socket or do a redo on the socket. All right, so let's talk a little bit about the actual usage, how you use a liner, what are the do's and don'ts of that. And the first one, this is something I do a lot of education on, especially with my newer amputees that come in, and sometimes my veteran amputees who develop some bad habits when I'm teaching them how to put on the liner. So the most important thing, guys, is you have to roll it completely inside out. Not just halfway down, not just a little bit turned down. You got to roll it inside out. And the whole reason for that is you want that distal end, that very end, to come in complete contact with your residual limb. And I just find it never fails that when a patient is, in a little bit of a hurry and they just want to kind of pull that liner on and they don't take the time to really turn it inside out like that, that somewhere down the line they start walking and the fit just isn't right, and they start have problems with sweating, they start having problems with air pockets and things like that in there. And then obviously rolling it up. A couple of things that I note when I have a patient, if I have a patient like what Ronnie mentioned, who has a lot of redundant tissue, especially my B case, making sure that that soft tissue is put into place. And usually I'll ask them, how did your prosthetist first put this liner on? And if they tell me that, well, the prosthetist did this with my leg, then I'll know, okay, obviously the prosthetist took that into account of putting that soft tissue in place, then putting the liner on. Another one, and I'm going to kind of steal your picture, Ronnie,
sure,
of an invagination, because I've talked about invaginations before, and I have a hard time explaining. Some people are like, well, what's an invagination? So basically it's when the scar folds in and there's like a little pocket in the skin right there. So I'm going to find that example real quick.
I sent her way too many pictures. I got really excited about this.
Awesome. Are you kidding me? I'm like, yay. Okay, so guys, that is an invagination, and it can be just a small, tiny one. This one I would consider to be a medium one. I've seen some of them that are deeper. And again, I talk to different clinicians. We all have a slightly different way of dealing with this. Sometimes the patient will tell me, well, the prosthetist told me to close the invagination all the way and then put the liner on. Some of them who have a bit more shallow invagination, they'll be told to kind of open it up just a little bit. And sometimes in the really shallow ones, we can almost even train the skin over time, but not usually, but sometimes we can do that to flatten out over the course of time. How do you deal with these, Ronnie?
Yeah, I mean, the biggest thing I think is I thought your two tips were spot on, but just using, you can see how the outline of that one is red.
Yep.
So, and that tends to get calloused, and it can get a little irritated after a long walking day. I think just hitting it with like a little bit of vitamin A and D ointment or Vaseline will help just kind of keep that from collecting any like excess friction or anything like that. That's always a really, really good method for skin that's getting seared on.
Yep. And definitely if I find that my patient has a because y'all know I'm a stickler with skin. If I find that they're having callousing, then I'll teach them, especially when they're doing the hygiene in the shower, take a warm terry wath. I can't talk today. Washcloth and gently rub at that area, and also putting on moisturizer to soften up that area, because we don't want to see a callus forming as much as we possibly can, because then you'll have cracks and bacteria getting into that part of the skin.
I'm seeing some great comments here from the crowd,
yeah.
And basically someone mentioned coconut oil, someone mentioned Vaseline. I just talked about A&D. Generally speaking, I guess this is a great time if you want to pull up. I've got a picture that says scar tissue.
Yep.
And so this picture we're about to pull up is a residual limb, medius articulation, extremely scarred on the lateral side. And anytime that we have compromised skin like this, it's really, really important to use something along the skin. So in this, we use a lot of vitamin A and D ointment. Alps makes a really great silicone ointment. Coconut oil is a good one. that tends to be really slippery over time. So the liner will just get like progressively slipperier and over time. So I don't like that as much, although I do think it's like a great natural alternative. Aquaphor is something that I know people use. So I think the whole idea that we want to just kind of bring people along with is it's reducing friction. We don't want the skin to stick on that liner. We want it to slide against that liner, almost like someone's walking in mush. So that will help skin like this skin instead of breaking down, getting macerated, bleeding, all of the above. So, this particular person is a really, really successful meatus articulation, uses the prosthesis 12 hours a day, has a custom liner, despite the fact that her residual limb isn't the best looking.
Yep. And that's a pretty extreme case. And guys, this is also something that when I have, especially someone who is still within the first 3 months after their amputation, I've got my thumbs and I am digging into that scar tissue to make sure there's no adhesions there. So for those of you here who are watching that maybe you are a newer amputee and you're within that 3-month time frame and your wound is completely healed, this is something to talk to your therapist about in terms of scar tissue management. I also want to mention, I love the liquid to powder stuff. I find the liquid to powder that Vital Fit has, it doesn't degrade the liners, and it also doesn't clump, and it doesn't make it slippery. But again, usually when folks come into my clinic, I'm like, what have you been using? What works? What doesn't work? And if they've got something that works and it doesn't degrade the liner, it doesn't break down their skin, then I just say, keep going with that and keep doing that. And if not, that's definitely a conversation I have with my patients a lot about what can we do to minimize the friction within the sleeve, within the liner, and keeping that skin healthy.
So on the flip side, I guess now is a good time to transition into sweating and when it gets too slippery.
Yes. Oh my gosh. So I'm looking at my cheat sheet notes here. The hygiene and the sweating, and Lord knows I've beat that dead horse on this show a lot, and I will continue to do so because it's incredibly important. Let's see, a couple more comments. A valley that came in. Yeah, a lot of folks here have the invaginations. And again, guys, it is a matter when you're doing the hygiene. And I tell folks this because they don't think of it, right? Especially if you cannot feel the end of your residual limb. It's really important that when you're in the shower or in your bath, that you are looking inside the invagination. This is oftentimes where bacteria can hide, especially if it's a deep invagination. You can have skin breakdown and not know that it's breaking down in there. And a lot of moisture can carry in there. So that kind of brings us to the hygiene side of things. And I tell my patients, especially here in hot, sticky Florida, once every 24 hours, you have got to go in the shower to make sure that you get a full rinsing. And, obviously with the residual limb, a gentle soap and a mild cleanser is usually the best way to go. And when it comes to these liners, my rule of thumb is if you're using it on your skin, okay, and it's not reacting with your skin and causing a skin reaction, then you can use that also on your liner. When it comes to washing these liners, they need to be washed once every 24 hours. That's my rule. That's like my stickler. And again, I live in a very humid state. Even in the winter time, it's very humid here. And the best way to prevent skin issues, skin infections, and breakdown is to keep those liners nice and clean. So I tell folks, bring that liner in the shower with you, turn it completely inside out. You wash it with the same cleanser that you're using on your body. Again, my personal favorite, just because it works for a lot of things, is the Vital Fit cleanser. But there's a lot of them out there. And then rinsing with hot water. And you rinse and you rinse. And then when you think you're done, you rinse again to make sure that there's no soapy residue whatsoever left on that liner. I can't tell you how many times I've had people come in who are absolutely meticulous with their hygiene, and they have this blooming rash on their limb. And they're embarrassed because they think that I'm going to think that they're not clean. And I'm like, no, I know you're clean. The problem is you're too clean because you're leaving that soapy residue inside the liner that will dry, and over the time will cause a very nasty reaction on your skin. So the rinsing part, especially with warm water, not throwing it in the washer, to get that nice and clean, and then hanging it to dry. So that's obviously, you see I have a huge soapbox on.
Soapbox.
Right, your turn, Ronnie.
All right. Yeah, I think you handled like pretty comprehensively the cleaning part, so I'm gonna leave that one alone. Yeah, just in terms of the sweating and everything like that, I see some really awesome here from everybody. You know, amputee store, liquid to powder. Drysol is one that's really good, but you got to be careful with. That is something that's going to close off your pores, you know, after using it. And what I always recommend is your residual limb is going to be a little more sensitive than the rest of your skin. So even if it's something that you've used maybe for your underarms or things like that, just use a little bit on your residual limb first, test it in one spot, and then you can go all out if it's good. That's going to kind of help close off the pores, actually reduce the amount of sweating. I've had people use unscented antiperspirant prior to putting on the liner. The Drysol is more of like a night before kind of thing. I'm trying to think. And, you know, there's lots of different variations on whether it's a silver sheath that goes underneath your liner, or like a swift wick sock that goes underneath. There's lots of different options now for that. It's a little less viable for above the, but definitely with below the knees can work out really, really good. You know, I think, you know, there's always different fitting factors considered, but that's definitely something you can do to help reduce sweat. For temperature control, Willowwood product that a couple of people have used, if it's the right liner for you. Like if Willowwood liners aren't good for somebody, this product isn't magically going to work for them, but it's called a Smart Temp liner, and I can't speak from personal experience, and I'm not sure how much of a difference it actually makes or whether it's smoke and mirrors, but I've had a couple of patients say that they like it. So, you know, on the patients where that liner is appropriate, you know, I'll present it as an option. But if we're not using a Willowwood liner, then I'm not gonna recommend that we use that, you know, just for coolness.
And I've had a couple of patients that when the sweat is really a problem here in Florida, they've found some success with that particular liner. I do want to jump, Bobby, I got to slap you on the wrist for this one, Bobby. I'm a very anti-Hibiclens on the liner kind of person. And just hear me out on this one, guys. Hibiclens is the cleanser, the antibacterial cleanser that they use prior to going into surgery, right? So all of us who, you know, if you're an amputee, you've had surgery, right? I've had my fair share of surgeries as well. And this is the cleanser that they give you prior to going into surgery that you're supposed to clean everything with, right? To basically kill anything that's living on your body, killing the natural flora, killing the bad stuff. So that basically when they open you up in surgery, they're not going to accidentally infect you, right? That's how strong this stuff is. So it really makes me cringe when I see that people use this on a regular daily basis. And Bobby, I'm not using this to pick on you. This is several people have made this comment as well on the show. The thing is, if you are continuously killing all the natural flora on your body, you're actually killing your natural defenses. Not to mention that this stuff is pretty drying. And yes, I have some people that say that they use it every day of their life for years and they've never had any problems. Congratulations. But the problem for most people is that this can be irritating to the skin, okay? And then when it comes time to using the big guns, when you have an infection, there's a chance for resistance there. So the only time I ever recommend that Hibiclens be used on someone on a daily basis is when your doctor has specifically prescribed it to you because you are someone who is perhaps prone to MRSA, right? And you have a history of those type of infections. Otherwise, this is a very harsh agent to use and it's not necessary. That's the thing, guys. If you're using soap and hot water, okay, and we've all learned about the benefits of hand washing and the true, you know, how you really hand wash and really get rid of germs these past 2 years with COVID, right? If there's one thing that we've learned is it doesn't necessarily have to be antibacterial. It just has to be able to get rid of the sweat and the odor. And a lot of times just a simple soap cleanser and hot water is enough to get the job done. So sorry, that's another one of my like, when I see people writing about HIPAA.
I like the Botox. I have a guy who worked in construction that got the Botox injections, and that really helped him because he moves 75-pound pieces of sheetrock all summer here in Chattanooga where it's 100 degrees. So I think that's worth having a conversation with your doctor about if you're a really big sweater. That's like last mechanism of defense. Like everything else I've tried doesn't work.
Yeah. And even with the antiperspirants, that's something, guys, that a lot of times I'll try to use other things first, because a lot of times with these antiperspirants, you have to put it on the night before to get it to soak in. If you put it on right before you put your liner on, it tends to make it kind of slippy slidey. So usually a lot of times I'll recommend the antiperspirants after we've tried liquid to powder lotions and for like my extreme runners. Speaking of which, Teresa says, I don't understand how runners who run in marathons can stop, take the leg off, take a liner off, wipe down the residual, put it all back on, and then continue running. Lots of time to do this. Yes. Lots of practice, Teresa. And actually there's this phenomenal, she's a Paralympian. She just did the Boston Marathon, Melissa Stockwell, and she's an above the knee amputee. Do you know Melissa, Ronnie?
Yeah. We ran a race together one time.
Oh, okay. I haven't met her in person yet, but she just did this video where she's just like, guys, this is life as an amputee when you're running. And she just, popped her leg off, did a quick wipe off with her shirt. And then
I've been there, done that for sure.
And then kept going. Yeah, you're a runner, so you can speak to this better than I need to be quiet. So yeah, Teresa, lots of practice. I think just getting that routine down. Let's see. We got a lot of great comments coming in here, guys. So here's a couple of other things about sweating, guys. Usually when someone comes in and says, I'm sweating a lot, I'm like, okay, it's Florida, so that's going to happen. The second part is, are they donning their liner on properly, right? So the whole point of these new liners compared to the P-lights of days old, right, is they have to have a total contact with the skin. If there's total contact with the skin, then there should be either little to no sweating in an ideal situation, right? So usually the first thing I do is I check to see how the person is donning that liner on to make sure that they have no air pockets in there that are going to be creating more sweat. The other part of it is the liner getting too big? Is it getting a little too stretched out, right? That's going to cause friction and shearing. It's going to cause those air pockets again for more sweating. All right. What am I missing? Am I missing something?
I think we're good. Yeah, we're okay. All set to do the next giveaway.
Okay. Oh, let's do that. What do we got? Okay. So guys, these next two giveaways, we're actually leaving it open until Friday. Okay. So you guys can get a head start on this giveaway now because you're going to forget to do it tomorrow. So go ahead and do it now. Go back to the Facebook page and hang on a second. I'll even post it for you guys. I'm going to make it real easy. Here we go. All right. Facebook page. Okay. Go to the Facebook page. All you got to do is like or follow the page. I think you got to follow it. And then like the post where you see my cheesy face there. All right. That's all you got to do, guys. And the prize for this one is a Cosi Talks Strong Body annual subscription. So for those of you who haven't heard me talking endlessly about this program I created, it's 150 exercises for above the knee and below the knee amputees, head to toe fitness exercises, specially adapted. All right. So one lucky winner will be chosen and you'll get a year-long access to all of these videos. So guys, all you got to do is go to the POA Tennessee page, Facebook page, like it, and then like the post where you see my picture. Yes? So guys, we're going to run this one. Those of you watching the replay, we're going to run this one through Friday. Let's see. Eric says the lotion Ronnie gets me, helps keep the liner on. And Susan's liner is all stretched out. So let's talk a little bit about that. When is it time to replace the liner?
Oh yeah, this is great. Okay, I'll just hit this is so easy. Generally speaking, insurance will cover 2 a year. What we're finding in our practice is that sometimes we can sneak through 3 or 4 a year, like without even, the insurance batting an eye at us. So it kind of just depends on what state you're in and what carrier you have. Some states like Florida, insurance companies are more grumpy. And Tennessee, they seem to be like, yeah, whatever you need. But yeah. 5 liners, but anyways, you know, it does vary state to state and carrier to carrier, but at the minimum, you should have 2 liners a year, which means that you're running through one every 6 months. Whether you want to use one until you blow through it and then switch to your second one, or some people do a rotation where they do like every other day or every other week. That's totally a personal choice. There's not a right or wrong way to do that.
Okay.
But when you're in pain, when your bone is sticking through the liner, you should replace it. Absolutely.
Yep. Van Gregory, excellent question. He says, would hand sanitizer be a viable option for cleaning the liner or the residual limb? Here's my thoughts on hand sanitizer. You know, I got a lot of soapboxes on hygiene stuff. So the only thing I see with hand sanitizer is it's got alcohol in it, right? It's some form of alcohol, and that can be an irritant to the skin. And anything that you put on the liner, you're also putting on your skin. So as a really quick fix, like you are out in the middle of nowhere and that's all you have, okay, but not making a habit out of it. What I usually tell folks in Florida is to get a lid. I got this hack off of Reggie Showers, my buddy Reggie Showers, right? Those little 3-ounce spray bottles that you can carry onto airplanes, to fill it with 50% water, 50% alcohol, and keep it in your glove compartment of your car with a couple of extra clean socks. Because yes, usually in the middle of the day, especially here in summertime, my patients and my folks have to take their leg off completely, spritz down their residual limb, dry it off, and put fresh socks on and put the liner on as well. But instead of hand sanitizer, I prefer the alcohol water solution for a quick fix during the daytime. That being said, Eric, it still means that at nighttime, at some point, you still need to get in the shower. That liner still needs to get in the shower and get completely rinsed off. I know. Yeah. Ronnie, your thoughts on hand sanitizer and the liners?
No comment.
He uses it, doesn't know. Okay.
Yeah, I'm going to act like I'm on a podium being interviewed now. I'm just going to say no comment to everything.
Like no comment, no comment.
Well, yeah, so I guess it's time to move on to the custom liners.
Okay, let's go to the custom liners. Let's do it.
All right. Yeah, so, you know, we've talked a lot about all the different liners here and everything. And one of my favorite things to do has to be to make custom liners. So I guess the first thing we can do, oh gosh, I've got my mouse all furled up here. I've got a video that says robot.
Yes.
I wonder if you're able to play that and how big that'll show up.
Let's find out. Let's find out. Okay. Here it is. All right, I'll hit play.
All right. Yeah, so that robot there, it's a decent size. Yeah, that goes in fast motion. I mean, probably over 20 or 30 minutes, that'll mill a foam blank down into somebody's residual limb shape. And that is part of the process that will allow us to create the male and female molding for somebody's custom liner. I've got another picture that says liner design. So right there on the liner design, this is a picture of what it looks like in the software. And we can do the percentage reduction on the liner. We can add more to make it thinner. We can do all sorts of different stuff to the properties of the liner. And then as we go to, liner molds, 1 or 2, it doesn't matter. Yeah, so this is an example of some of the different shapes that we can accommodate with the custom liners. So the middle one, for instance, is a child that literally has a pencil-like residual limb. I can't even imagine, other than P-Light, any other way that I fit him if I wasn't able to make a custom silicone liner. On the right side is someone with a really, really long residual limb, more like a V instead of a U down at the bottom, so we're able to get that proper taper and shape. And then on the left side is my construction worker. He's was 350 pounds and just has a really, really large leg, and we wanted to be able to get a liner that fit him just right instead of just kind of okay, as he's moving the sheetrock around and everything like that. So 3 completely different examples of ways that we can go with this. I've got a question here. Do we use limb scanning for custom liners, or can we do both? So on the one in the middle, we would have done a scan. It's mostly just bone. There's there's not a lot of tissue to compress, but the one on the left, there's no scan him because of the way that the tissue hangs. I want to hold it, I want to shape it, and help create some of that design prior to importing it into the computer. And to Denise, custom liners, some prosthetists do make their own custom liners. It's very, very rare, but some practices do incorporate part of their thing that they do, or some of them cast and send them off. Like, so for instance, Ottobock is one of the bigger manufacturers that makes custom liners, where any prosthetist in the United States can send a mold to Ottobock and get a custom liner back. And then just showing a couple of limbs here. Let's do the custom limb without liner 1.
Custom limb. Sorry, my mouse froze for just a moment.
Good. Yeah, my computer's been acting strange as well.
Okay, come on. This one. With or without liner? I'm sorry.
Without, yeah.
Without, okay. Right there?
Yeah, so right here, and we'll make this one a little bit larger. But this is an example of a limb that has a couple different contours to it. Really, really bony fibular head, really, really bony medial condyle on the inside of the knee. And, this is a great example of how a custom liner can kind of help protect and throw the cushion in the right place on this kind of leg. So now if we go to the picture of the custom liner that's associated with this one, custom limb with liner 1, you can kind of see how that line, I very, very much still have a lot of the shape intact. So one of my favorite things about the custom liners is I can see everything that's going on the playing field here. I've got a very, very clear view of what's happening. Almost like if a football coach were calling the plays from the grandstands instead of down on the sideline, you can't really see anything. You see a bunch of kids running around and getting hit. But up in the stands, you can see exactly how the patterns work. If someone was running the right route, and it's kind of the same thing here. I can see exactly where that fibular head is. I can see the medial condyle, but everything is cushioned and protected. And I can take a cast directly over that liner and know exactly where my landmarks are, where I can add pressure, relieve pressure. Whereas if I were to put an off-the-shelf liner over top of that was cylindrical in nature, I would lose all of that. So in my mind, when I cast that person, I'm already playing from behind. I can't see any of that detail, and it's that much harder to work with. So remember, the liner, regardless of whether it's custom or whether it's off the shelf, it is the foundation of what we do. It's like if you were building a house, the first thing that they do when they build any house these days is they pour a really nice concrete slab. It gives you a great foundation and a great structure to actually build your house. And it's the same thing with these liners. This is our concrete slab. This is where we're starting. If the liner doesn't fit good, it's going to be really, really hard to make a socket that fits good. I love custom liners. I've got a shout out from Tyler here. He's one of our other prosthetists over at POA, and he is actually the guy who has allowed us to do custom liners at our practice because he was an engineer before coming into prosthetics. I knew how to make custom liners, but I'm not an engineer. And Tyler was an engineer and didn't know how to make custom liners. So we make a pretty good team.
It is a very good team. Very nice.
So, I guess that's kind of my spiel. I'm looking here at the pictures on custom liners specifically. We showed a little bit about the robot. And then, I guess the last thing that we can show, it's less custom liner, just linery in general, but can we pull up the AK taper?
Yep. AK taper, here we go.
So with this leg, we'll zoom in on it a little bit, but you can see it's very, very small at the bottom and very, very wide at the top. There's always this misconception that if a liner doesn't fit somebody, it's because it's too loose. And in my experience, that couldn't be further from the truth, because a lot of times when we've seen cases like these, the liner has to match the taper. So if you're putting a liner on this that's straight, it's always going to want to purge itself off. But if you're putting a liner on that matches the taper of the residual limb, that liner should lay on the skin with some compression, and it will stay on. this wouldn't be like a custom liner example. We could fit this person in one of our off-the-shelf liners, but I would want the bottom to be a smaller size than the top. The top needs to be significantly bigger than the bottom for this liner to be able to stay on. So just another misconception, and we see it all the time. And you know, with these liners, we want it to fit your leg. We don't want to try to force it into something. You know, we definitely don't want to make a round peg square hole situation. Liner has to fit your leg is the very first thing, and if it doesn't, you need to keep looking for one that does, or asking for one that does. I guess that's my 2 cents. I mean, that's the number one thing, the number one takeaway, because if you start with a liner that doesn't fit, you're playing from behind.
Yep. No, and I gotta admit, that's kind of one of my pet peeves is when I see like the little out pouching that comes down, like the liner's kind of like sagging a little bit.
Yeah.
And you've got that pocket in there, and I'm just like, like just trying to get that to like lie on there flat. Awesome. All right, let me just kind of flip through some of these comments.
And
all right.
I took down one earlier. Somebody mentioned preventing a liner from running at the bottom of the glute. It's tricky on above the knees, you know, because that above the knee liner is going to come all the way up into the groin area. And we want that liner to come right up to the groin without flipping, because if it flips, generally that can cause little nips and little irritations as that person's wearing their prosthesis. So there is an art to cutting the liner. A lot of times I want to make sure that person's lying down on a table. I want to get as much coverage as I can on the limb without getting the liner into any sensitive areas or having it flip over. And then I want to have that person stand up into the prosthesis and make sure that the way that their body works with gravity doesn't cause the liner to flip, and make extra trims and extra adjustments from there. I'll use Eric as an example. When Eric comes into the office, we might spend 30 minutes trimming his liner. It's hard. It's not easy. But that's just kind of some of the time that it takes for some of these folks. Mm-hmm. And it's not always just as straightforward as, oh, let's just cut it straight across here. If I wish it was.
No. And definitely not to take scissors to your own liners. Can I just my PSA for the evening? Yeah. So how do you go about, actually, let's do the last giveaway before because I know we're gonna be getting questions for this one. Last giveaway, guys. Okay. Super easy. We're leaving this one also open until Friday. Guys, this one's a $50 gift card. $50 gift card. That should hopefully wake you up just a little bit right now, guys. Okay. So go to Instagram. Okay. And I put out the handle here for POA. It's POA _TN for Tennessee. Okay. Go and follow them. That's all you got to do. You got to follow them and like the post where you see the Cosi Talks post. Okay. We're going to choose a raffle for a $50 gift card, $50 gift card. Okay. By Friday. Okay. And guys, I'm going to say something about the giveaways on this show and how these work. Okay. In order for me to be able to produce this show, I need the help of my sponsors, like Ronnie, POA Tennessee, and a couple of other sponsors that I have this year. Without the help of my sponsors, I cannot produce this show. In return, I like to give thanks to my sponsors and show my appreciation by helping them grow their own social media platforms, guys. We all need this to help grow our reach, to help grow our businesses, and to keep serving this community. So when we do these giveaways, it's our way of giving thanks to you, our viewers, for watching and supporting, but it's also to help these sponsors who are in turn helping the Cosi Talk Show. It's all one nice big circle. So guys, please take the time, go to the Facebook page, like the Facebook page, go to the Instagram page as well, and hit like. All you got to do is just click one button and you can be in the running for a $50 gift card. Pretty good deal, right? Absolutely.
We've got tons of pictures that are just sitting on our phones and our iPads right now at the office. I promise one day I'll upload them and we'll have a really cool Instagram page.
Keith says the liner holds in the adductor roll as well. Yes. That helps so much. And it's guys, the adductor roll, also known as one woman came in, she's like, it's my little chub rub. Yeah, it's a little part in the thigh that just kind of gets in the way and gets pinched in that socket. So if you can tuck it into that liner, and that helps control that as well.
Just dealt with this on a person recently with the adductor roll above the knee. I like keeping my trim lines a little lower for people, but then that means I need to have that liner up a little higher to be able to hold the adductor roll. And what we found on this person, a tapered liner to be able to taper out and hold his adductor, because when we were using a straighter liner, the roll just flipping the liner over. So yeah, a lot of nuance that goes into liners, especially with some tricky things to deal with.
So that feeds into my next question. What sort of questions do you ask your patients when it comes to choosing the first liner for them, the kind of liner they're going to use?
Yeah. Boy, so the first kind of liner that they use, I try to make the best decision for them, because a lot of times they're coming without a lot of their own information, and we're dealing with socket design, we're dealing with foot, we're dealing with knee, and oftentimes people aren't going to have a strong opinion on the liner. Now, where I love working is when they do have their feedback coupled with my experience, come up with a plan that's going to work best for both parties. On the because I guess I am a little of isn't the right word, but like I said, I'm really psyched on custom liners, so I have a reason to not do the custom liner as opposed to a reason to do any sense. So that's the plan that we're going at the beginning. But my things that I look out for, and if I think someone's not going to do well with it, well, we're not going to put them in it. Because maybe there's going to be something that's easier for them to use, easier to don and doff. If it seems like they're going to go into a pin liner, I custom cushion. I don't do custom pin. So it kind of depends on what we're looking at. But I'd say 80 to 80% of what we do is custom liner, and then we do have another 10 to 15% that exists, and that's what keeps me doing and continuing to learn and grow within other things.
There you go. All right, guys, this has been a very full evening. We've been on here for over an hour and a half, Ronnie. We've given.
I'm ready to go for another hour. I mean, we're talking about liners, we're talking about prosthetics. Basically, yeah, I got to the office at like 9 this morning. A bunch of people, and now we're still talking prosthetics, and I'm still excited. So I guess
awesome.
let's do a through the night Cosi Talks one evening, and we'll just see who can be here to ask a question.
It's like the PBS special. We'll do a PBS special Cosi Talks, 24-hour marathon, telethon.
That may just be one person. It'll probably just be Eric.
Eric or one of my kids watching the show.
Yeah.
All right, guys. Well, we are going to wrap it up, guys. But those of you, I'm going to go back and I'm going to pick out, if I missed your question this evening, guys, don't be shy. Send me an email, send me a message, put it in the comments section and tag me. Those of you watching the replay, again, if you have any questions, we are going to go back and check these questions out, and we were here to answer them for you. Ronnie, as always, man, it is a total blast having you on the show. Thank you so much for
this was fun. I try to keep it real. I try to give real world answers. I'm not trying to give like a PowerPoint presentation on liners or anything,
Hey, we got the pictures up. I'm happy we got those pictures up and running. Guys, thank you as always. And again, please go to the Facebook and Instagram POA Tennessee pages, like them, like the Cosi Talks post underneath it. You'll get put into a raffle to win some really nice prizes. Show Ronnie here some support and love, and thank you this way for coming on the show and sharing all of his wealth of knowledge with us this evening. I know I learned a lot myself, so thank you again. Guys, I will see you next week, same bat time, same bat channel, general question and answer session. Zach, if you're still on here, man, the 18th, man, it's on like Donkey Kong. All right. Ooh, Kitty came to say hello. Mine just left. Mine just took off. She's been sitting right on my foot this whole time. All right, guys. As always, thank you for letting us be a part of your lives this evening, and we'll see you next week. God bless. Bye.